Hello everybody! So today I'm here to talk about contraceptives. Why I want to talk about contraceptives is because there are a lot of people who use it or take it, but they don't actually know how it works or the kinds of effects that it has on your body. I have categorized the contraceptives into 4 different categories. So we've got the barrier method, we've also got combined method, which includes progestogen and estrogen, and there's also the progestogen only, and fourthly there's a copper coil. First of all, I want to talk about the female anatomy. So in the woman's body, the ovaries produce sex hormones, including progesterone and estrogen. What they do is they promote healthy development of the female sex characteristics during puberty, and it also promotes fertility. It also prepares the uterus for menstruation. So when a female becomes pregnant, they produce more estrogen and progesterone, which prevents the other eggs from maturing. What estrogen does is it stops the egg from ripening and ovulating. Progestogen is made synthetically to work like progesterone, the hormone, and it thickens the mucus at the entrance of the womb, making it difficult for a fertilized egg to implant itself. Some of the side effects of estrogen include bloating, breast tenderness or swelling, nausea, leg cramps, headaches, indigestion, and vaginal bleeding. The side effects of progestogen includes breast tenderness, swelling, headaches, migraines, mood swings, depression, acne, stomach aches, back aches, and vaginal bleeding. You should not take the combined pill, which is both progestogen and estrogen, if you have a history of blood clots, if you have a history of stroke or heart attacks, if you have breast, cervical, vaginal, or uterus cancer, if you have unexplained vaginal bleeding, if you are pregnant, if you smoke and have high blood pressure, if you smoke and are over 35 years old, if you have diabetes, or if you have oral migraines. I can't cover all of the contraceptives available, but I'm going to explain some of the more common ones. First of all, the contraceptives that work with the barrier method. Female and male condoms are the only type of contraception that protects you against STI and pregnancies. The male condoms are 98% effective. They are reliable. They protect you from STIs. In most cases, there are no medical side effects, and there is a possibility of tears if it's not used correctly. Some people are allergic to the material that the condom is made of. Female condoms are 95% effective. You can often find both of these at the local GP or contraception clinics in the UK for free. Next, I want to talk about the combined method. So one of the combined methods used is the combined pill, which is also commonly known as the pill. It is 99% effective. You take it for 21 days and stop for 7 days and then start again. You need to take it at the same time every single day, or else it might not be effective. It may also not work if you miss a pill, if you vomit, or if you get diarrhea. If you take it with certain other medications, it also might not be effective as well, so you have to check that with your doctor. Another type of combined method is the contraceptive patch. It is a sticky patch and it releases hormones into your body through the skin. It is more than 99% effective. It lasts for 1 week. Then you change the patch every week for 3 weeks, and then you keep it off for 1 week. Next, I'm going to move on to the progestogen-only methods. So there's a progestogen-only pill, which doesn't contain estrogen, and it is 99% effective if taken correctly. However, if you take it in a typical use, it is 92% effective. This means that a lot of people typically don't take it on the exact same time, which makes it less effective. You have to take the pill every single day with no breaks. This pill is often taken by people who aren't able to take the combined pills. There's 2 types of progestogen-only pills. There is the 3-hour one and the 12-hour one. With the 3-hour one, you have to take it within that time frame of 3 hours or else it's not effective. And with the 12-hour one, it means that you have to take it within the 12 hours for it to be effective. Another progestogen-only method is intrauterine system. It's a T-shaped plastic device to put in your womb by the doctor or nurse, and it releases progestogen to stop you from getting pregnant for 3 to 5 years. It is more than 99% effective. Another one is a contraceptive injection. It releases progestogen into your bloodstream to prevent pregnancy. It lasts for about 8 to 13 weeks, depending on the type. It is known to be more than 99% effective. Another one is a contraceptive implant, which is a small flexible rod that is put under your skin in your upper arm, and it lasts for 3 years. It is more than 99% effective. When you first put in that rod, you may find some bruising or tenderness around it. The last type of contraceptive is the copper method. This is called the intrauterine device, and it is a T-shaped plastic or copper device that is put into your uterus to protect you from pregnancy between 5 to 10 years. It's sometimes called the coil or copper coil, and it is known to be more than 99% effective. One of the downsides of the copper coil is that the first 3 to 6 periods can be more painful and heavy. There is really small risk for you to get an infection or it moving around in your body. It can be a little bit uncomfortable when you first get it placed. What the copper actually does is it actually transforms the composition of the mucus so that it becomes thicker, so it becomes more difficult for the sperm to get to the egg. Most women can use it because it is not hormonal, and it is also not affected by other medicine. There's also no research that states that it will increase the risk of other long-term side effects.